Enzyme inhibition. There are 4 different types of enzyme inhibition: competitive, non-competitive, suicide, non-competitive enzyme inhibition. In competitive enzyme inhibition, the inhibitor is structural analog of substrate and competes with the substrate for binding to the active site of the enzyme. Now this increases the Km value, however Vmax remains the same, and this type of inhibition is reversible with addition of excess substrate. Most of the pharmacological drugs use this mechanism to bring its biological effects. Example being methotrexate inhibits folate reductase in tumor cells and is hence used as an anti-cancer drug. Sulfonamides has got structural resemblance to PABA in the bacteria and are used as antibiotic drugs. Next one is non-competitive enzyme inhibition. Here the inhibitor does not resemble the structure and binds to site other than the active site. Now this decreases the Vmax, however Km remains the same, and this type of inhibition is irreversible. Now most of the poisons and toxic substances use this mechanism to exert their harmful effects. For example, heavy metals act as enzyme poisons by reacting with SH group of the enzyme. The antidote for heavy metals is British anti-levisate, and this acts as antidote by providing SH group to the heavy metal so that the host enzymes are. The next type of inhibition is uncompetitive enzyme inhibition. Here the inhibitor binds to the enzyme substrate complex, and the good example is inhibition of placental alkaline phosphatase phenylalanine. The last one is suicide enzyme inhibition. Now this is similar to competitive enzyme inhibition, where the inhibitor is structural analog of the substrate and the inhibitor binds to the active site of the enzyme. After binding, this gets converted to a more effective inhibitor and completely denatures and destroys the enzyme, hence the name suicide enzyme inhibition. So example is allopurinol inhibits xanthine oxidase and thereby reduces the production of uric acid, and this has been used in the treatment of gout.